काही करू नकोस, काही करू नको. We are already live on YouTube. सबसे पहले कनिका को हमारी मेहरा के बच्चे हाँ करेंगे, बोल तो रहे सर, म्यूट कर लीजिए. Yes.
Good afternoon, everyone. Welcome to the virtual 12th Professor Mehra Oration being held today. On behalf of PGI Chandigarh and Department of Otolaryngology, I welcome all of you to this solemn function. We start the proceedings by the welcome address by Professor G.D. Pudi, Dean Academics, who is officiating today as Director PGI.
Good evening. Padam Shri Dr. Hans, Dr. Rajji Vyande from Pune, is Professor of Otolaryngology at the Bharati Institute at Pune. Professor Naresh Panda, Head of the Department, PGIMER Chandigarh. Dr. Jayamanti, Professor Jayamanti, also from the Department of ENT at PGIMER Chandigarh. The family of Professor Y.N. Mehra, Mrs. Mehra and their children, who are also joining virtually in this oration. I welcome you all the delegates and the attendees of this oration, not only in PGI, outside PGI, and also all over the world. We have assembled for the 12th Professor Y.N. Mehra oration, which is being held virtually due to the unprecedented COVID pandemic situation. I would like to thank the orator of today's evening, Padam Shri Professor J.M. Hans, who is an alumnus of the Institute, who very kindly accepted our invitation to be orator this year for the Professor Y.N. Mehra oration. Coincidentally, Professor Hans also joined PGI Chandigarh 40 years ago, at the same time when I joined this institute. And Professor Mehra, who was Professor Emeritus of PGI and former Dean and Head of the Department of Otolaryngology, was the face of the specialty of otolaryngology in the country and was the founder of the Department of Otolaryngology at PGI Chandigarh in the year 1962. He was also called the father of this specialty in India. He inspired many who came here for the training. Many of his students are occupying high academic positions in the country and abroad. And he was a role model for many, and including me. When I joined this institute and I coincidentally visited his OPD, I was really impressed the way he used to carry out his OPDs, the way he used to teach his students in the OPD, and the way he used to appreciate all the small good things of his students in the operating room as well as in the OPD and the ward. We have had 11 orations so far since 2008, and many stalwarts, including our alumni, have delivered the oration. The 11th Dr. Y.N. Mehra oration was delivered by Dr. K.T.V. Reddy last year. during the ENT Alumni Conclave at PGI. I welcome Padam Shri Professor J.M. Hans again, who has accepted our invitation to deliver this year's oration. Thank you.
Thank you, sir. Now we have Professor Rajji Vyande, who did his MS in PGI in 1979 and was a senior resident in the department from 1979 to 1981 before leaving for UK for his higher surgical training in the Royal College of Surgeons, Ireland. Dr. Vyande had close association with Professor Mehra. May I request him to speak about his memories of working with Professor Mehra?
किसी ने लॉगिन किया सर Please unmute yourself.
Can you hear me? Naresh, can you hear me?
Yes, we can.
I'm very sorry for this connection problem.
I have to restart, no?
Okay.
Yeah, it's fine.
Okay. Honorable Dr. G.D. Puri, Dean of Academics, PGI Chandigarh, the ENT department headed by Dr. Naresh Panda, my very good friend, and my all colleagues who are on this virtual Zoom meeting, a very good evening to everyone. It's a great pleasure, pride and privilege for me to speak few words about Professor Y.N. Mehra, our revered teacher. In fact, he was such a towering personality, it is very difficult to describe and speak about him in few words. However, keeping the time constraint in the mind, I will like to express my feelings for Dr. Mehra in a nutshell. Dr. Mehra was born in 1931 and he graduated from Amritsar Medical College in 1955, and later on he went to McGill University in Canada, Montreal in Canada, for pursuing getting his ENT postgraduate qualification. In 1961, he acquired the postgraduate qualification of FRCS, and then he was later on invited by the government of India to establish the Department of ENT in the upcoming institute of PGI Chandigarh in those days. Well, all of us know that he was a great teacher and a very dexterous and a skillful surgeon. However, it will be injustice to him if we fail to acknowledge his versatile and unique qualities, which I myself perceived in my stay in PGI for 4 years. First and foremost, he was a great master of the subject. He had a tremendous mastery over the routine and especially the micro-otological surgery. Well, I remember that probably he was the only one stapedectomy surgeon in the whole northwest of India in those days beyond New Delhi. And we used to get all the referred cases, not only the cases for stapedectomy surgery, but all the complicated ENT problems for the whole northwest of India. I really hardly remember any complications of the stapedectomy surgery at his auspicious hands. In those days, there was no facility for the lasers, the skitters, and the micro drills. He used to carry out the surgery with the routine cold instruments with a sufficient dexterity. At the same time, I remember the rhinoplasty surgery that he was also interested in. And today I see the surgery of rhinoplasty taken up by so many budding ENT surgeons today. However, whatever techniques he showed us in those days in late 70s are still being followed up today without much change. He was a great motivator as well. I remember that he used to motivate all of us and his junior consultants in his department to make sure that everyone does some research work in the surgery of in the field of otolaryngology. At the same time, one more incident that I would like to put forth, that his personal assistant, Mr. Kishan Chand, was working with him as his personal secretary. He made him work and then he started manufacturing various middle ear implants under his supervision. And today, I'm very happy to say that Indian Audio Center established by Mr. Kishan Chand is the foremost manufacturer of the middle ear implants and the stapedectomic pistons till today. But that dexterous mind was Professor Mehra behind Mr. Kishan Chand's great efforts. Dr. Mehra was hardly a very efficient and hard-working. He put his Herculean efforts in putting forth the Department of ENT on the map of India. I still remember in 1977 when I joined the department, I think we were probably the first one to acquire the Zeiss operating microscope, and the microscopic surgery in whole PGI was started by Professor Mehra in our department. He used to love that Zeiss microscope as his own baby. At the same time, gradually as the time passed, Professor Mehra established the Department of Audiology, Speech and Hearing, and at the same time the vestibulometry studies. We were the first one to start the Bekasi, CC, tone decay audiometry, and if I am not wrong, in the year 1978, we were the first one in India to acquire the brainstem evoke response audiometry under his leadership. He was extremely human person, very compassionate, very sort of empathetic towards his colleagues. I saw his behavior with the class 3 and class 4 employees of the hospital, and he used to be so caring with them as well. Dr. Panda, I would like to take this occasion to mention that number 2 in the department who is not with us today also, Professor Honorary, the Associate Professor Dr. MML Arora. In 1980, he sustained a cardiac problem. It was a coronary event. Dr. Mehra made sure that he got immediately admitted. Those were not the days of angiography and angioplasty. He was admitted under Dr. P.L. Wahi, the great cardiologist, and he made sure that Dr. Arora gets the best possible treatment. In those days, under his supervision, he used to pay visit 2 times a day to Dr. Arora at his bedside and made sure that Dr. Arora got discharged very successfully. He was a great human being, no doubt. At the same time, I remember his quality that he was extremely rational and a very remarkable person. He never behaved in a very sort of impulsive manner. He was a very thoughtful person, a man of few words. I remember in 1978 January when we visited Nagpur for the All India ENT conference, where Professor Mehra contested for the post of president of AOI Association. Unfortunately, because of some politics of a particular group of people, Dr. Mehra could not win that election. And unfortunately, he lost to Professor N.K. Apte from JJ Group of Hospitals, Mumbai. However, at the end of the day, we had a gala dinner following the election results. And Dr. Mehra was so sort of congenial, so friendly with the Bombay group of people, including Dr. Hiranandani, Dr. Jovi Disa, Dr. N.K. Apte, Dr. P.P. Karnik, all stalwarts in ENT. And Dr. Mehra showed that winning and losing are the coins, are the 2 sides of the same coin. It was a great teaching from him. Lastly, but not the least, I really appreciate Dr. Mehra's astute observation capacity. I don't know my colleagues who would be there today, whether they have noticed Dr. Mehra's extremely rewarding quality, that he was a great observer. He was an astute observer. He was a man of few words, but he used to observe very meticulously. And that made him a great surgeon, that made him a great teacher, a great head of the department, a great administrator of the hospital, and a great human being too. Really speaking, Dr. Mehra sir, you were a great guru to all of us who are present here today. The word Sanskrit guru, gu means darkness and ru means prakash, light. A guru is a person who takes you through the darkness and shows us the path of light, how to go, where to go, what to pursue in life. He was a great guru to all of us. Sir, lastly, I would say, Dr. Mehra sir, wherever you are, you would be listening to us. You have been great person in our life. Your name has been embossed on our heart and on our brain today. And we will go on pursuing the path that you have shown us very ethically and successfully. I salute you on behalf of all PGI students from you, sir. Wherever you are, stay in peace, sir. We will go on remembering you forever. Thank you very much.
Thank you, sir. May I now request Professor Jaimanti Bakshi to introduce the orator, Professor J.M. Hans.
Respected Professor J.D. Puri, Dean Academic PGIMER, Professor Naresh Panda, Head Department of Otolaryngology and Head Neck Surgery at PGIMER, dear faculty colleagues and alumni, good evening all. It's my proud privilege to introduce Professor Jitendra Mohan Hans, who is Chairman and Director, Dr. Hans Center for ENT and Cochlear Implant at New Delhi. Dr. Hans did his MBBS from Mehra University in 1978, DLO from Delhi University in 1981, and MSc from PGI Chandigarh in 1983. He briefly worked in PGI MER as senior resident before moving to New Delhi, where he finally settled. Dr. Hans worked in Ram Manohar Lohia Hospital for a long time and became professor when the hospital was upgraded as a teaching hospital, and later he retired as head of the department there. He has a bag full of awards in his kitty. Notable amongst them is the Padam Shri by the Government of India in 2005, which is the 4th highest civilian honor in India. He is an accomplished cochlear implant surgeon in the country and has popularized the Varia technique in cochlear implantation, which many cochlear implant surgeons have been using now. He is the founder member of the Cochlear Implant Group of India. He is part of the Defense Research and Development Organization sponsored project team that developed an indigenous bionic ear in 2014. He is one of the few in the country to be doing the auditory brainstem implant in children. And he is the inventor of Hans speech valve for speech rehabilitation after laryngeal cancer surgery. He has served as the honorary surgeon, ENT surgeon to the Prime Minister of India, and he is the government nominee at Ali Yavar Jung National Institute for Deafness, Mumbai, and the All India Institute of Speech and Hearing, Mysore. Sir is member of the advisory boards of the Union Public Service Commission and World Health Organization, and he is the member to the National Program on Prevention and Control of Deafness, India. He is advisor to the cochlear implant surgeon to Pingalwara Trust in Amritsar, and he is member at the Committee of Cochlear Implant, Government of India. Sir, we are happy to have you with us to deliver the 12th Professor Y.N. Mehra oration this year. May I request you to kindly deliver the oration?
Thank you very much. Can I share my, I'm not able to share my screen.
Yes, sir, you can share.
No, I'm okay. Now I can do that. Yeah. Can you see that?
Yes, sir, we can see.
Okay.
Yes.
Thank you very much for the lovely words. I will start my oration by Charan Vandana of respected Madam Mehra, respected Dr. G.D. Puri, my very dear Dr. Naresh Panda, who gave me this opportunity, Dr. Rajji Vyande sir, to have opened and talked so beautifully about Dr. Mehra, and the faculty of PGI Chandigarh for organizing this beautiful event. Professor Vyande Mehra Oration is, believe me, better than any other honor I have got till today, and I'm grateful to Naresh once again. When I had just joined PGI in the March of 1980, Professor Mehra was leaving the department, and that was the saddest part of my life, actually. I was happy to have joined PGI Chandigarh, but I was very sad that he was leaving. And all my years, I wanted to be close to him and just be able to see him from a hand's distance. And when I became the organizing chairperson of the third SIGI, which I had held in Vigyan Bhavan, and I had invited the Honorable President of India, the great Abdul Kalam Sahab, all the program was written by the committee which we had, but I just stood for one thing, that in this, I had to honor one person, which was Professor Mehra. Can you believe it? I had never even worked with him, but I wanted him to honor. And everybody agreed, and this is the picture there. You can see our great Abdul Kalam Sahab, me, and Professor Mehra. This was probably maybe something of the last janam which I had to give it back to him, because I never was his student, but I had always heard great things about him. And I think this was the best thing I got after becoming the organizing chairperson of third SIGI. But my stint in PGI Chandigarh started in 1980, lasted till 1983. And as told by Dr. Rajji Vyande, we had another great stalwart, Dr. MML Arora. Though I was always afraid of him because he was a perfectionist, and but I learned a lot from him. The best thing I learned from him was how to face the Western people, because I had in my later life the opportunity of visiting almost every country in the world. And I was there as a WHO fellow for 3 months each at many centers, which I'll just tell you. And there I remembered one thing which Dr. Arora had told me: oh, don't get impressed by these people. We have more experience and more knowledge than these people have. So don't just get carried away. Try to do what you wanted to do. And that was a big thing he had told. And I always remembered that. The next teacher which I had was Dr. Pandhi, my soulmate, I would say. He was the one who taught me everything about ENT, the small things which I learned from him. And I always remember the gesture he had showed when he called me for his first laryngectomy outside PGI. He had left PGI and he was doing his first laryngectomy, and he called me. I was in exam going then. And we did that laryngectomy on a trolley, because in his nursing home that time, the table did not arrive, the operating table. And he told me, Dr. Hans, will you assist me on the trolley? I said, sir, even if you tell me to do it on the floor, it is an honor to be with you. And you called me to assist you. It's such an honor. I touch his feet, virtually sitting from here, my great Dr. Satish Pandhi, sir. Dr. Maan was more of a friend. And without him, the stress of PGI would not been, I would not been, it was impossible to take that stress which PGI Chandigarh gave. Because I remember, I was told that even a gadha becomes a horse there. And we were all asses when we came there, and we came out as the stallions. We came out as good horses. All credit goes to our teachers from PGI Chandigarh. I bow my, we lost Dr. Maan, but he's always in our heart as a great friend and a great teacher. We made great friends. Suresh was 6 months my senior. Achal was 6 months my junior. And Kabir was 1 year my junior. And they were great friends. I think their humor kept me in PGI despite the hard work we had to do. My journey after PGI was quite different than being in PGI. My first posting was in RML as a senior resident, though I wanted to remain in PGI, but somehow I could not. And my first posting was in Ram Manohar Lohia Hospital for 3 years. And after that, when I became a specialist through UPSC, I stayed in RML as a junior consultant, and I used to go to Parliament Annexi and set up a ENT department there, and I used to go there for 2 hours pre-lunch, and the rest of the time I was in RML hospital. So that's how my journey started. But PGI made me a cancer surgeon. I remember when Dr. Arora sent me and Dr. Suresh Sharma to JJ Hospital, Mumbai for 3 weeks to learn cancer surgery. When we came back, we once were talking to him and he said, "Oh, everything is operable in cancer. You can't say, don't operate this, we can't operate this." So carotid ligations, bilateral block dissections, total laryngopharyngectomies, pullover surgeries, esophagus, there was no end to it. Bilateral maxillectomies, there was no end to it. But gradually, after coming back from PGI, I did that for a few years, but then actually got bored of doing cancer surgery. And that was the time when I was thinking what to do next. And just because I was a good laryngeal surgeon, I landed up doing laryngotracheal surgery for some time. That was about 7-8 years. After which, because I had worked with Dr. VP Sood for a lot of time in Delhi, I switched on to rhinoplasty surgery. And from there, because I traveled around the world in my WHO fellowship to many cochlear implant centers around the world, I became a cochlear implant surgeon. And today I call myself an inner ear specialist, because now it is Dr. Hunt Center for ENT, Hearing Care and Vertigo. So I primarily I'm doing only ear and only inner ear for that matter. I have juniors, 4 juniors who do rest of the surgeries, even cancer surgery, but I specialize in that. Now I would like to tell you a few things which I did in laryngotracheal surgery. And as Professor Jayamanti said, that I also developed a Hunt speech valve. It was during these days, and I would pick up cases in RML which were, others would say no, and I would say that was the PGI training. So this was a case in which there was a long laryngotracheal stenosis post-intubational, and I said I'll take it up and start doing. And this is, you can see this is the intubational tube, and this, after the resection would have been done, this would have been slided down, and we started removing, and you can see almost 4.5 centimeters of trachea we removed. 2.5 centimeters we got from the laryngeal drop, and the rest 2 centimeters, 2.5 centimeters by flexing the neck and stitching the chin skin to the sternum skin and keeping it there for the next 2 weeks, so that we didn't have to put a tracheostomy tube or a T-tube. And this was the 4.5 centimeters we removed, and then did an end-to-end anastomosis, extraluminal and extramucosal, by pre-placed sutures. And you can see the post-op video showed absolutely normal airway of this person. And 2 years later, you can see, except for the bad keloid which formed along the Sorensens which we had taken, a very large Sorensen, because bringing out that kind of a large piece, and doing an end-to-end was a little difficult. But this was on the table, no T-tube, no tracheostomy tube, and the patient became all right and absolutely fine. The other case which I remember of the laryngotracheal trauma, which I used to do, was a large defect of the skin and the anterior tracheal wall and a stenotic area of the glottis. And this patient, you can see, came to us with this. There was an injury, multiple surgeries done. And when you see a close look, you can see that there was epithelialization of the posterior wall of the trachea, and there was tracheal stenosis. There was bilateral cord palsy and a bad situation of the trachea. And I took up this case. I don't know what I was thinking of doing, but I had just brought a tracheal mesh from Canada when I was in Toronto. Some tracheal surgeon was using a tracheal mesh, and I said, I'm going to use this. So I said, okay, I'll try this case. And first we did a laryngo fissure, did a one side unilateral cordectomy, and then closed it on the T-tube. You can see that this is being closed. And this was the tracheal mesh. It is a monofilament polyethylene mesh which we used to close the tracheal defect, so that there is no paradoxical respiration which occurs if there is no stiffness in this area. And you can see this has been closed. And then this was the mesh which we used. And this gap of the skin was covered by the deltopectoral flap. It was covered by the deltopectoral flap. Sorry. And the third day, the patient was speaking. This was almost like 7 years after that the child spoke, and he started crying. You can see the tears in his eye. He started crying because he was never able to speak. There was glottic stenosis and there was loss of this. He could not cover it and speak. And the third day he spoke and told his name. He started crying. On the third week, we removed that. And on the third month, we removed the T-tube also and put the thing back, and he was absolutely normal. The beauty of the tracheal mesh was that the tissue grows inside through the pores inside on the other side and lines the inner side of the trachea also. And you can see this is the Hunt speech valve which we had developed during that period when I was doing these tracheal surgeries. And because the Springer valve, speech valve was very costly, 6,500. This was a silver thing which I made for just 150 rupees. So this was very effective, and I used to use this, though my first lecture I had given in PGI only, and showed this thing, but it never got used because I stopped doing tracheal surgery after that and went on to rhinoplasty surgery. So there was nothing new, nothing which I have to tell about rhinoplasty because all of us are doing, and there was nothing so great I did. But it was cochlear implant surgery, which I started doing in 1999. Again, going against the tide, I started the Varia technique. This was probably in my nature to do something different because every time I would get bored of the surgeries, routine surgeries, and every time I wanted to do something different. And so I picked up. And this also, from 1993 to 1998, I visited all these places, the House Ear Institute, Children's Hospital, Toronto, Canada, Ear Clinic, Würzburg, Germany, Ear Hospital, Tokyo, Japan, and the Bionic Ear Institute, Melbourne, Australia, for 3 months each as a WHO fellow, and learned about cochlear implant in a big way. Not only surgery, but what cochlear implant was, what happens when we put inside, all those changing trends which were happening during those time. In those 6 years, 5 years, I learned. And when I started doing it 1998, I met, he was my inspiration. Everybody knows the great man, Professor Graham Clark from the Bionic Ear Institute, who invented the cochlear implant. And it was such an inspiration being with him for 3 months in Melbourne and learning the tricks and trades of cochlear implant surgery. And with all these, Professor Brandt, Professor Pyman, Dr. Nedzilski in the House Ear Institute, again, Dr. Graham Clark, and they were great inspiration to me for cochlear implant. And when I came back in 1998, finally, I said, no, I have to do cochlear implant. But then I met this gentleman. In 1998, I met this gentleman. I had gone to Saloniki in Greece, and I met Dr. Trifon Kiradzitsi. He's my soul, my teacher, my everything. And he told me, Dr. Hans, I think cochlear implant can be done by a different technique. And I said, sir, I'd like to see you. And he had these 2 surgeries and showed me the varia. Can you believe I said, sir, this is the surgery for cochlear implant? Just seeing those 2. And I requested him, sir, will you come if I keep my first case? Because I've traveled around the world, learned about the posterior tympanotomy, and I want to do your technique because I think this is a better technique. So he told me, yes, I will. Dr. Kirtane is also calling me for a few surgeries, and you come there and see those also, and the next day I'll come and help you. And can you believe that 5 surgeries he had at the in Bombay, where Dr. Kirtane was. And I kept saying during the surgery that this is a very easy surgery and very easy surgery. I'd seen Dr. Trifon doing it in Saloniki. The next case, he asked me, Dr. Hans, you scrub and do the thing. It was Dr. Kirtane's case, and he asked me to scrub. And can you believe I assisted him? And the next day, 14th August 1999, was my surgery. When he came, I said, sir, will you not scrub? He says, no, I've seen you. Now you do it, and I'm sitting outside. And can you believe my first surgery? He said, you do it. And he just sat outside. That was the kind of confidence he had in me, and the blessings he gave me was immense. And this is what Varia was. You know, instead of the large mastodectomy and through the small little hole of a posterior tympanotomy, now you create a tunnel which is 1.4 millimeter and grow permeatally. You see a beautiful panoramic view of the middle ear cleft, the promontory, and you can see that this is the tunnel 1.4 millimeter vis-a-vis the large mastoid cavity which we create. That is the lateral semicircular and the facial far behind. And this is how I did. And you can see that this is the Varia technique and this is the posterior tympanotomy. And I just didn't look back. I just kept doing the Varia technique, which was very easy. It just takes about 35 minutes for me to now complete the implant. And I feel this is one of the best inventions Dr. Trifon Kiradzitsi make. And this is how it goes about. The only thing is, many of the seniors still think that it is a blind surgery. But if you have the embryology in your mind, you will not find it a blind surgery. And it is a very, very simple. You will not be able to injure the facial nerve. I have done over 3,000 cases now in the last 21 years and never have there any be a problem. I'll let you know how it is all about. And you have a beautiful view of the cochlea. You can do a round window insertion or a cochleostomy. You can shape the cochleostomy in such a way that the electrode just goes inside beautifully. And you will see that these are my initial cases. You make the tunnel in line with the cochleostomy so that you don't have to do anything. See, the chorda is still intact and the electrode is going inside the cochleostomy straight. So that is the beauty of this technique, and without any complication. You just have to direct the electrode inside and it goes all, even the medal, which is 31.3 millimeters, it just goes in smoothly. So, and the drum is put back. It is even less than a stepidotomy, I can tell you, that easy. So instead of going through that posterior tympanotomy, you have a beautiful view of the middle ear through which you do the major work of doing a cochleostomy and putting the implant electrode inside the cochlea. And the magic behind this is the perforator. You have to use it with both your hands, because on the right side, which we do 80% of the cases, you'll have to do it with the left hand. And on the left side, which you do about 20%, only when you're doing, when the right is contraindicated or you're doing a bilateral, that you have to do it with your right hand. So you actually have to be using both your hands if you are doing a Varia technique. And the beautiful perforator, as we call it, it is called the Trifon perforator. And this is the magic of the Varia technique, but you'll have to really master it before you start doing. And in 2002, when I had just done about 50 cases, I was called for the first Varia or the Transcanal conference in Dead Sea, Israel. I was the only Asian then. And now there are over 75 surgeons only in India who are doing this technique. This is Dr. Trifon and the team of people who were learning this technique gradually. And most difficult situations were made easy because we had a panoramic view of the middle ear. You can see an anteriorly placed sigmoid sinus still would be almost touching the posterior canal wall. We could still create that tunnel. An ossified cochlea in the basal turn and a distant cochleostomy with a high jugular bulb, we could do it easily. A dehiscent facial, and still we are far ahead of that. A dehiscent jugular bulb, and still we could do a cochleostomy where we wanted. An ossified cochlea to this extent, and we had to drill out 7 to 8 millimeters of the cochlea before we entered the scala tympani. Now just imagine another half a millimeter and you have the carotid canal there. And people have put the electrode in the canal, but here we could drill that much of the cochlea. We could see the promontory, keep drilling till we reach the scala tympani and put the electrode inside. And gushers, you can just see we invented the 3-hand technique. Can you believe we have still the gusher on and the electrode is already inside? So this is the beauty, because you have a panoramic view. You can use 3 hands. Your junior will hold the suction, and you can with 2 hands pack the cochleostomy so well that it stops gushing on the table, and there is no problem post-operatively. So this is the 3-hand technique of dealing with a CSF gusher, which I had to encounter a lot because I was doing single cavity cochleas, basal turn fistulas, connectivity with the intra-aortic canal, large cochlear aqueducts. All these would give you a bad gusher, and you should be able to have a beautiful view so that you can take care of the CSF gusher post-operatively. Now, over 3,000 implants, and I had never a facial palsy. Please understand, there were 3 paresis, 2 completely recovered and 1 incomplete recovery. And these were because during the surgery, when I was explaining and making the tunnel with the perforator, my junior, and I was concentrating on answering what the questions were coming, and my junior did not put the saline, and that heat actually destroyed the nerve. And in 1 case, pretty badly, in 2, recovered after 3 to 4, 6. But there was never ever any flap necrosis, implant extrusions, no implant failures, because if you are putting the electrode nicely inside the cochlea, neither are you injuring the cochlear internal structures nor the electrode. So, and less than complete insertion was just in 12 cases out of 3,000. And these were the cases where either there was a single cavity in which the electrode would not go, or there were ossified cochleas in which the whole electrode will not go. And there was no case of misplaced electrode. I saw in cases where the posterior tympanotomy was used. Now just imagine this is the electrode in the carotid canal, that is in the eustachian tube, that is in the hypotympanum, and this, I don't know from where it came into the CP angle, and in the brainstem region, the electrode came. The other is inside the cochlea, but this came. So I was called for doing a revision, and we removed it. There was a massive gusher, but we could do it and pull it back. But how did it go there? I don't know. But this is the kind of situations. But see, all these surgeons were great surgeons, and they're still stalwarts. But just because they had to work in the angle of the chorda tympani with the facial nerve, that the area was so small that they could not see at times what they were doing while putting the electrode, that they went into wrong situations. So it is not these days. Please understand, all surgeries will have some kind of problems, but you will have to deal with them as quickly as possible. A hematoma, don't wait, immediately aspirate it. Immediately. Next day you should aspirate. Because if you don't, if you try to give pressure bandage or do something, you will, the blood will become hard, and then you will have to give an incision and drain the clot from inside. It will not go. That much of the blood collection will not go just by pressure bandage. Don't try to delay. Do it as early. If there is a bad skin, which will happen in any case, if the stitches have not been given properly, you can have a bad skin, a keloid. You remove it as early as possible. Don't try to postpone it. And you can see that we are not touching that area of the post-oral region. We just gave that incision, removed that bad skin, stitched it back, and absolutely normal. There are complications. Every surgery will have a complication. But if you do a septal perforation and a stepidotomy, that is wrong. Now, if you delay it and this organized blood gets infected, then you are not able to save these implants. So please don't wait. Do it as early as possible if you don't get into these kind of situations. I never got into, because I would immediately request the patient to come and get it operated and get it treated, whatever problems have occurred. Yes, if you try to push it through a small incision, you will put the coil in such a way that the tissue starts to grow under it and it will come out. So you will have to correct that also as early as possible. This is a delay case, but you should identify it early. You understand that the receiver stimulator is not absolutely subperiosteal on the bone. The tissue has started growing under it. Immediately do it before it gets into this kind of a situation, and you will be able to save the implant. Yes, again, if you are pushing the electrode receiver coil through a small incision, the receiver coil would get angled, and a little incision, little trauma to the edge would lead to the magnet coming out. Or if it is an MRI incompatibility, these things would come out, and you should know how to put it back. All these are for budding surgeons. I think the seniors all know it very well, but please try to do it as early as possible. Don't wait, because the moment you wait, some reactions would occur, infections would occur, and gradually you will have to lose the implant. So don't do that. And once I was established, I'm grateful to all the centers who started calling me around the country and in SAARC countries around the world, where I went and did all these surgeries. And I'm grateful to all my students who learned from me, and you know, I helped them learn this technique so successfully that they are now all doing these technique. I did children from almost every part of the world, whether it was US, Nigeria, Iraq, Iran, Kazakhstan, everywhere. So almost everywhere from every part of the world I operated, and even did 8 to 10 implants in a day. Please understand, that's a big, and not once, many such government programs which I was covering, where I had to do 20 implants in 2 days. I would start early in the morning about 7 o'clock, and by 6 o'clock do 8 to 10 implants in a day. Yes, there were about 2 OTs running. I would do one and somebody would close. I go to the other and then come back before they had opened up. So just imagine, this surgery was so quick that I could do so many implants in a day, and so many at different centers. And these people learned it better because they were seeing so many surgeries being done on the same day. Because if you see one and then see another after 3 months, you tend to forget. But these people became so good in their work, and they learned because I could do so many implants in a day, and all successfully. Believe you me, please understand, during these 8 to 10 surgeries also, never ever there was a facial which I gave in. So hurrying up did not spoil the thing, just because the technique is so beautiful that I could do so many with no problems at all. And then once the technique was established, people started calling me all over. Thanks to Naresh for having called me for this great Professor Mehra lecture today. I think this could be anybody's delight from where you have studied. You are giving the oration. Thanks again to Naresh for giving me this opportunity at orations at AOI, at neurotology, at every place I gave lectures. Not only that, Pakistan, Bangladesh, Afghanistan, all these countries and SAARC countries, I went and operated and gave lectures, and around the world at the Asia Pacific, the European Symposium, all these places I had the opportunity, and people were gradually taking Varia also as a surgery. I still say that there are people who have their own this thing, they want to go, but I don't say both the techniques are good. But believe you me, if you try doing this, you will find it very, very easy technique, very easy technique. And there are now 75 surgeons all over India who do this technique very beautifully. The feather of the cap was when the Cochlear company called me in 2018, and they wanted to see whether I'm scientifically and histologically right doing this technique. And in 2018, just imagine, almost 18 years after I did my first implant, they made me do 2 temporal bones and then did a histopathology. And in both the cases, they saw that neither was the chorda injured, nor was the lateral semicircular canal injured, and the facial was far behind. Both histologies showed that there was no problem and the facial was far ahead. And I've always been telling that if you know the embryology, you will never go wrong, never ever go wrong, because the facial recess means the facial nerve can never be in the facial recess. So we have to learn that this is not a blind technique. The only technique when we are doing trachea, we have to be not seeing the recurrent laryngeal nerve. We have to be as close to the tracheal rings as possible, not try to see, and we will save the recurrent laryngeal nerve. So sometimes we have to go the other way and see that we can do. And now so many cases, yes, my juniors have given facial. Either they have not done temporal bone dissection properly or they have become overconfident. Please understand, never overconfidence, which when I do my case, I do it as the first case every time, even today. So that you have to respect the child, respect the surgery, respect what their parents are giving you, their children. So you have to do it meticulously. And lastly, I would just mention the angel in my life. I must tell you that he read an article about minimal invasive technique on surgery and called me to Rashtrapati Bhavan and wanted to know what I was doing. And I was given only 15 minutes that day. This was sometimes in 2004 by August or even a little July. And then he put me in the DRDO program. And then I was surprised that 2005, next year, he gave me the Padma Shri. Because please understand, this was the DRDO program he had put me, and I did the animal trials there. This is the DRDO office in Vizag, where I was invited, and it was an honor to be with him. But in 2005, the greatness of this man was that he was told that no government servant can get a Padma Shri. You know, that's the reason why no IS officer gets, and no person in the government can actually get a Padma Shri. But he said, no, I have to give it to Dr. Hans, and that's how, being a government servant, because AIMS and PGI are autonomous bodies, they're not under government. They can get it, but nobody. I was the first and the last ever government servant, working government servant, because of this great man, because he said, no, I have to give. I've seen this man, and that's how I got it. And I'm honored that I got it from this great man, and it is just such a pleasure to be. There were other people who honored and felicitated me by different thing during my course, but this was the Chhattisgarh Ratan I got from the Chief Minister, because I had done about 200 plus implants as government program there. The International Rotary Award, Vocational Award, which was given to me, I was called to Dubai and given this award, and a lot of money to do these implants. Almost 2 crore rupees I was sanctioned, and with that I could do many implants in poor people, and that was the award they gave me there. And then the chief guest and professor emeritus, which I got from Vaidehi Institute of Medical Sciences, Bangalore. I'm the professor emeritus still there, and I go and operate, and they call me. Thank you very much, Vaidehi Institute. But the blessings came from the Pingalwada Trust. Madam once called me, Madam Inderjeet called me and told me, Dr. Hans, you have to start the program in Pingalwada. So I was saying, she must be joking. In the deaf and dumb school on the 3rd floor, she says, we'll make an OT here and you have to come. And unfortunately for me, the first case was a Mondini deformity, and I had a gusher, but all went right. And every 3 months, 4 months, they would call me for 3-4 surgeries. We have done about 20, 25 there. And then she honored me, and this was a blessing from that great lady from Pingalwada, and I'm still remember. But please understand, the greatest comes when So this is the best blessing which a child who has started hearing and speaking can give you. And I think it is a blessing that all of us who are doing cochlear implants, including Dr. Naresh Panda, he does it so beautifully. We give two things. Please understand, we not only give hearing, we give speech. So it is a blessing that we are cochlear implant surgeons today and give such kind of children. In Innsbruck, every year now we have a workshop in our name, in Dr. Trifon and my name. And just because there are 8 temporal bone stations there, we call 4 from India and 4 from out of the world, around the world, where we refine their steps in Varia technique. And this happens every year. This time it did not happen because of COVID. So next year again, inshallah, it will happen. And now we have the Dr. Hunt Center, where we have 2 temporal bone stations. And anybody who comes here can do the temporal on fake-on bones, please, because we don't get the temporal bones now in Delhi. And we have an auditorium with 50 seats where we can, an AVT, switch on, audiology, state of art, 5,500 square feet of only OPD. I don't operate here, but this is what we have. And now I call myself an inner ear, not only hearing, but I also take care of the vertigo. We have a state of art habilitation and diagnostic center, VNG and all these things. And one thing which I would like to tell here and sometimes maybe later tell you about is steroids, which are helping not only patients with Meniere's, but with sudden sensorineural hearing loss, acute tinnitus. And every day we have I have 4 stations in my clinic where as many as sometimes 8 to 10 injections we are giving, and people are coming just because they're getting better. So now my center is not known as Dr. Hunt Center for ENT and cochlear implant. It is called Dr. Hunt Center for Hearing Care and Vertigo. So, but please understand, all these years I did not leave one thing or change one thing, and that was my golf. Started in 1985. I have won a lot of tournaments, and still at this age, I play golf with all the passion, and that is the relaxation for a surgeon who has to undergo a lot of stress in doing all these things. Thank you very much. And once again, thank respected Madam Mehra, Dr. Puri sir, Dr. Rajji Vyande, Dr. Naresh for having given me this opportunity. Thank you, Naresh, very well. And all the staff in PGI Chandigarh for having given me this honor. Believe you me, I'm very nostalgic and I'm very grateful to all of you to having listened to me like that. Thank you very much.
Thank you very much, sir, for the wonderful exposition of your career path after leaving the portals of PGI Chandigarh. Sir, your career path is a true inspiration for all the residents who take a lot of stress to choose their subspecialties just after MS. Starting as a cancer surgeon and then covering the whole of ENT, and you finally chose to become an inner ear specialist, and you achieved great success in that. Thank you so much, sir. Now, I would request Professor G.D. Puri, sir, to kindly do the honors of displaying the scroll and memento to be sent to the orator.
Dr. Hans, this is the scroll which is presented to the orator on behalf of the Dean Academic. So Professor Puri would be, sir.
Thank you, sir. I wish I was with you this time.
Yes.
From you, but no problem. This itself is a great honor. Thank you very much, sir. Thank you.
And this memento is handed over by the director of the institute,
Okay.
and Professor Puri is officiating director today. So he would be doing the honors.
Thank you very much, sir. Thank you. It's a great thing to have it got from you, sir. Thank you.
Thank you, Dr. Hans, for accepting the invitation and joining with PGI faculty and other colleagues for Dr. Vyande Mehra Oration.
Thank you,
And
sir.
I
Thank you very much.
Dr.
Now I would request Professor Naresh Panda, Head of the Department Otolaryngology, to present the vote of thanks.
Good evening, everyone. Professor G.D. Puri, Dean Academic and Officiating Director, PGI Chandigarh, Madam Usha Mehra, and members of the family, former directors, former professors of the Institute, Dr. Rajji Vyande, who readily accepted my request to talk about his association with Professor Mehra, the alumni of the department, many of whom would be attending the oration, respected seniors, teachers, particularly Professor Pandhi sir, faculty colleagues in PGI and dear friends. On behalf of the Institute, I would like to thank the orator for this evening, Padma Shri Professor J.M. Hans. He readily accepted our invitation to deliver this oration virtually. You have just now listened to his journey and the successful and exciting career path during his oration. Needless to say, a gem cannot be polished without friction, nor a man perfected without trials. Um, uh, Thank you very much, and we were really happy to hear your oration, sir. We would like to thank everyone, including former directors, former faculty members, and the present faculty members of PGI to join for this oration. My sincere thanks to the faculty of the department, notably Dr. Saurabh Patra and Dr. Gyan Nayak, and the residents for working out the logistics for the virtual oration. Our sincere gratitude to Mrs. Mehra, Madam, for her constant blessings and help to the department and the institute. The oration session would now be followed by the alumni academic webinar meeting, which has been scheduled from 5